Welcome to Amplify Social. Amplify Social will focus on advocating human-centered issues, adding a stronger voice to the issues that confront us. By amplifying these social issues, we expect that we can get more support and attention for the greater public good. By amplifying selected social causes, we expect increased support for social causes by the greater Ghanaian society for our greater good.
My name is Gifty Ayoka. I'm a speech and language therapist at Talking Tips Africa Foundation. We offer speech therapy services for persons with autism. Autism spectrum disorder, it's a neurodevelopmental condition that affects how a person perceives the world around them or interacts with the world around them. So it's characterized by deficits in a child's social communication, deficits in a child's social interaction, and also characterized by repetitive and restricted interest. And so if I say a child's communication, so for instance, a child would not be able to communicate their needs, they are not able to use gestures. If I say restricted interest, they sometimes have a particular thing that they are so attached to, and so they want to do the same thing over and over again. Let me also add that there's not one autism, but many, or that's why we call it a spectrum, because in our profession we always say that if you meet one child with autism, you've met just one child with autism, because every child on the autism spectrum is different. It could also come with some strength. So a child with autism could spell very complex words without starting school. They could count 1 to 100 when maybe the class is doing about 1 to 10. And so these are some strength that it comes with. So it's a combination of actually strength and weaknesses, and we need to embrace the whole condition as it is. As speech therapists, we work with the persons with autism or children with autism in this case, and because they are social communication deficits and they are social interaction deficits, we try to close this gap and help them to associate more, and also to be able to interact with their peers, play appropriately, So when they come in, we do an assessment to see where the child's level is at, so that we are able to intervene at the right level. There are some children who are verbal and others who will be non-verbal for life. So what we do is that when you come in, we try to do is that we help the child to communicate, and so which is different from talking. This is because if a child is non-verbal, and then they come to us and we get them to use pictures to communicate a need. We feel that the child has been able to communicate, okay, not necessarily talk. Others are verbal, they talk, they are able to communicate their needs. And so that is where we come in. If you go and you get a diagnosis, it is to help your child, it is not to label the child. And so that I'm encouraging parents that if you see any of these signs, that we have mentioned, please speak to your pediatrician. Don't be afraid of a diagnosis, because early intervention, yields amazing results. The earlier you intervene, the better the outcomes.
Hi, my name is Dr. Marilyn Mabel Wilson. I'm a neurodevelopmental pediatrician and the CEO and medical director of Mission Pediatrics. Autism is a neurodevelopmental condition. This means that we detect it when the child is young, and it has to do with the way the brain functions. It affects communication, the way the child understands language and expresses themselves. It also affects the way the child socializes, interacts, and the way they behave. Let me tell you a little bit of some of the things that you may see that you may suspect autism. So one important one is communication. A child who is delayed by 2 years is not using short sentences, 2-word sentences, or a child who is not using their eye contact properly to communicate. A child who is not pointing to share interest or to requests by 18 months, or a child who doesn't like to interact with others or his peers. These are some of the red flags that you see in children with autism. Another area is repetitive behavior. So these children may be interested in doing certain things or certain activities and are very comfortable doing it all day long or very, very often. Why should we diagnose autism early? Early intervention is the key. Early detection and early intervention is really important for the prognosis of children who have autism. This is because the young brain between the ages of 18 months and 4 years is still developing. And so if we diagnose a child early or we detect it early, the kinds of treatments that we give this child are much more likely to provide a better result. And so I encourage all parents, if you for any chance suspect or have an inclination that my child is not developing typically for communication, seek help, see your health provider, see your pediatrician, see anybody who can help you.
Early intervention plays a crucial role as to whether a child with autism will transition into adulthood and be able to hold a job. We do have success stories. My son is doing well. He's in mainstream school. He's doing well. He still gets some support in the classroom. But I would say that again, early intervention has played a very crucial role as to where he is now. And we do have some really amazing talent in the autism community in Ghana. We have Note as a data entry clerk. We have Edwin is I think he's about 14. He's a great artist. Yeah, he draws amazingly well. You know, he can look at you and then just draw you. The kind of support we want from government is education ministry, the health ministry to work together, because if we are getting the early detection from the child welfare clinic and then we intervene early, they would definitely go on to mainstream, and then because they've had that early intervention, it will be easier for also the teachers to work with them. Okay, so it takes two of these ministries to be able to work together to give the children with autism some support. Yes, but also what we want really is that if government can have we can have speech therapists in the various regions, because as we speak, we don't have speech therapists in all the regions. Yes, and so some have had to travel far and wide to come to Accra to access therapy, which is really not a good thing for traveling with a child with autism on a public transport. The other thing is that if we can also have occupational therapists, we work hand in hand with occupational therapists, be able to have occupational therapists also assigned to each of these regions, in the schools, in the hospitals, where parents can just walk in and get service without traveling far and wide to access speech therapy, and occupational and other therapists also. If we're able together, we'll be so happy about that. Yeah.
Hi, my name is Kojo Oponkroma, Member of Parliament for Francia UB and Minister responsible for information. We join the rest of the world to re-echo the theme: inclusive education for persons with autism spectrum disorder, ASD. I believe every child with ASD should be given the opportunity to develop their skills, their talent, through the quality inclusive education that we offer in this country. And this can only be achieved through early detection and intervention, through speech therapy and other interventions. If you suspect your child has autism, do not wait and see. Speak to your pediatrician and start early intervention. Remember, early intervention yields better results and sets the child up for a great future.
So I'd like to encourage parents out there, teachers, whoever comes into contact with children, at a very early stage in their development. If you notice any of the signs that we have mentioned in your child, please do not do the wait and see. Some have waited for years and nothing has happened. And so we would ask that you contact your pediatrician, speak to a speech and language therapist, ask questions and seek help and seek it early. Whilst you are in denial, we do respect that. But remember that the child needs help. The child needs to go to school. The child needs to build their communication skills, their interaction skills, and we need to help them at a very early stage. So please, if you're a parent and you're seeing some of these signs that we mentioned, do not wait and see. Seek help and seek it early.
Amplified, supporting young businesses, building people.